have no idea what that.
Oh, okay. All right.
And look, that's probably the highway department or somebody else that purchased from Cargill. It wasn't the highway department.
All right. Thank you.
Thank you.
Yeah. I got a quick question. The septic tank reimbursement, that comes from the state, doesn't it? Doesn't that pass through from the state?
Yes.
Yeah.
Other questions? By the way, if I miss a hand, interrupt.
Right, I was just letting you guys know that I had to stop the recording so that I could start the live stream. You can't do both at the same time.
Okay, great.
And Keith, you're a little erratic in your voice, just so you know.
Megan or me?
Keith, you're coming across a little erratically in the audio.
Okay, let me turn my head and see if this works better. The speaker is over there.
I think so.
We have a motion to approve the financial report.
I'll make that motion.
I will second.
Thank you, Cassie. All in favor?
Aye.
Aye.
Opposed? Great. Now we have a program, Children in Special Needs. Lori Fisher.
Hi, I'm back here. Hi, so I'm just briefly going to report. So in March of 2021, we had a record year for referrals for early intervention. April is, I think, going to be the same. I think that families are taking their little ones back to pediatricians, and we are seeing a wicked influx of referrals to the early intervention program. We still have staff shortage, provider shortage for speech and teacher, for EIN, the 3 to 5 services. We are in the process of hiring a coordinator position, so I'm excited to get somebody new on board. And we recently promoted one of the service coordinators up to a supervisory position to really help with all 4 of the programs with the day-to-day operations. Any questions?
Lori, I was just curious, of the referrals that come into EI, do you have numbers of the percentage of them that actually qualify after the evaluation? Is it most all of them or a portion of them?
I can get you actual percentages. I can see it in my head right now, but I don't want to blurt out anything that might not be very accurate, but more are qualifying than not. I'll say that much. So I would say at least 3/4, if not more, are qualifying for early intervention services.
Okay, thanks.
Mm-hmm.
Okay. Other questions? Thank you very much.
Thank you.
Environmental health.
Hi, this is Eileen. My camera won't come on. I don't know why.
Well, welcome without, oh, there it is.
Okay. So first are the hearing and consent orders, which were in your packet. The first one is with Warwick Mobile Home Park, where they didn't get their permit in a timely manner. They did get their permit and paid a $50 penalty. The next is with Willow Crest Mobile Home Park, the same thing. They were delayed in getting their permit, but they paid a $50 penalty. The next is with Owen Orchard, where they did not submit their water operation reports in a timely manner for February, March, and December of last year. They have submitted them and they paid a $50 penalty. The next is with Dugan's Country Grill, where they were in violation and that a worker in the kitchen was not wearing his face covering properly. They paid a $50 penalty. And the next is with Drifters on Owasco, where they failed to collect their 2020 nitrate sample. And so they did do a makeup sample. They posted public notification, and then they submitted certification that they post public certification. And, they did post public notification, and they paid a $50 penalty. So that's all I have on hearing consent orders.
Questions on the consent orders?
I'll need a motion.
I'll make the motion to accept the consent orders as written.
Second?
I'll second it, but just a quick question for Owens Orchards. It says lake water. I'm sorry. I thought it said lake water. I was wondering what they were doing with lake water. Never mind. I will still second it.
Okay. Further discussion or questions? All in favor?
Aye.
Very good, thank you.
Okay. So the next is, I'm going to share my screen because I do have a couple graphics and hopefully it will work. I don't know whether it will or not. Do you see my screen or no? You still see me?
Still see you.
Darn it. Let me try one more time. All right, do you see it now?
No.
Or no? Oh, okay. Well, I will just talk then without it. Maybe it will show up at some point because it should be on. Okay, so the Cayuga Lake TMDL has been released, and the TMDL stands for Total Maximum Daily Load. So basically, under the Clean Water Act, states are required to develop a total maximum daily load for a water body that does not meet the water quality standards for a pollutant. And so since Cayuga Lake had been designated as having excessive phosphorus, they were required to create a TMDL for that lake. And so basically what the TMDL does is it creates a target level for the amount of pollutant that the lake can receive while still meeting water quality standards. And then it allocates that load to both point sources and non-point sources. So DEC has been working on this since 2013, and it was supposed to be published probably 3 years ago, and no one really knows why it was so delayed, but the draft was finally out. So basically the way it works is the state DEC calculated the maximum amount of chlorophyll A that the lake could have and still meet its standards for a drinking water body. And then they calculated the amount of total phosphorus that they could have to obtain that chlorophyll A. So they have a relationship between total phosphorus and chlorophyll A. So then they know how much total phosphorus the maximum is that they can discharge into the lake, or that can be discharged into the lake. And then what they did is they estimated the current annual phosphorus loading using a model based upon extensive sampling of 5 streams that they did as part of the Cornell University water cooling project. And then they extrapolated that information to the whole watershed. And then they used a model, it's called a SWAT model. I don't know what SWAT stands for, but they take into account the land use, the soil type, the slope, and then they determine what is the load by land use. So I think you do have my screen now, and as you can see, they broke the lake into 4 different segments. And so the first one shows the segment, the mid-north part of Cayuga Lake, and it'll show, what percentage is cultivated crops, pasture, forest, developed land, and then of course the water body portion. Then the next one is the main lake mid-south, and the next is the northern end, which is mostly forest and less agriculture and more developed land. And then the southern end around the Ithaca area is more forested and more developed land and a little less agriculture. So what they did is following the process that I just summarized really quickly, and it's a lot more complicated than what I'm saying. The document is like 100 pages long, and it goes into a lot of detail on, you know, how they went through that process. But basically, the summary is that they say the source of the loading into the lake itself, and they did break it into the 4 different segments, but I calculated it into one instead of the 4 different segments. So basically, they're saying that crops contribute 65% of the phosphorus into the lake, hay and pasture 18%. Point sources like the wastewater treatment plants, I think there's maybe 7 wastewater treatment plants that discharge into the Cayuga Lake watershed. They're 9%. Forest is 5%. Developed residential is 2%, and that's mostly like stormwater. And then septic systems is less than 1% that they calculated. And then what they did is they ran some scenarios to see how they can reduce the amount of phosphorus to that point that they determined was an acceptable level. And so basically they recommended a 30% reduction in total phosphorus from the whole watershed. And they said that it should be broken down in a 42% reduction in crops, 40% reduction in hay and pasture, 15% reduction in forest, 10% reduction in development, and 5% reduction in septic systems. And so, you know, so far so good, I guess. You know, I mean, there have been a lot of comments. I'm part of a couple groups, and comments are going around on some issues. People have, you know, issues with maybe how this information was developed. And, you know, there's a lot of assumptions that go into something like this, but they did collect a very lot of data when they were doing the Cornell study, and they used that for this. So it is data driven, but whenever you have any model, you do have to make some assumptions. So the report goes on to state that a critical factor to successfully implement the TMDL is the identification of appropriate pollution reduction strategies available. And this is, in my opinion, where the TMDL could be more helpful than it really is, because the reduction strategies that they discuss are not specific at all. They're just very general. For the most part, they say that the wastewater treatment plants they don't really, you know, they're operating pretty well. There's one, a very small one that doesn't have a phosphorus limit, so they're going to work to bring that up. But overall, they felt that they're working pretty well. And so the report goes on to say that for Cayuga Lake, seeking appropriate reductions in agricultural loads is key, because these loads represent the dominant external loading sector and the greater proportion of the total controllable load to the lake. In addition, agricultural best management practices are generally more cost effective. And then it goes on to say, for the sector, implementation relies upon voluntary installation of best management practices by local stakeholders in compliance with the conditions of the CAFO permit. So, you know, my concern is that I was hoping that the TMDL would be more prescriptive, such as specifying in what subwatershed should they be focusing. You know, this subwatershed seems to have, you know, discharged more phosphorus, so let's focus in this area, and this best management practice would work well in this subwatershed. And I think a lot of people are disappointed that the TMDL basically just ends by listing a host of both best management practices that are available, and then they list the funding sources, and so they kind of end the report by saying the implementation of non-point source best management practices is expected to primarily be a continuation of the work of various stakeholders throughout the watershed. So they're saying we should really continue what we're doing. However, that has not been, you know, I don't see how that, if we continue what we're doing, how we're going to get a reduction. So, you know, that's my concern, and I think that's a concern shared by some other people. Comments on this draft TMDL are accepted until mid-May, and so I'll be making that comment that that hopefully if they could be a little more prescriptive in saying exactly where these best management practices should go within the larger watershed. So that's the 2-minute version of a very lengthy scientific report. Any questions on that at all?
Eileen, I have a question, if I may, and this key, and that is that a number of people have requested that the comment period be extended because it is so long and so complicated. What is your thinking on that? Is that something that we take a position on or not?
We certainly can, because that is, it is a very lengthy report and it's very deep in the science. And so to make intelligent comments, I think more time would be good. So if the board would like to vote on extending the extension for 90 days, I think that's what a lot of groups are asking for, is a 90-day comment period as opposed to the 45-day that they are providing right now. So if people want to vote on that then to see.
Before we actually do a motion, finish. Elaine, you had a question or no? Your hand is up.
I can't hear Keith.
I think Elaine has a question.
Well, I guess, can you hear me now?
Yes.
It was more of a comment. I mean, I know there was a big debate between the TMDL and the 9-element plan, and somehow I was under the impression people thought the TMDL had far more regulatory teeth than it looks like it does, because it appears that there's going to have to be voluntary compliance in a lot of this. But my bigger question, Eileen, is do you expect something different from the 9-element plan in terms of it being more prescriptive when the results of that for Wasco Lake come out?
I do. I think that they are trying to run different scenarios in different watersheds as part of the modeling. Mm-hmm. And so I'm hopeful that it's going to say, hey, the best bang for your buck is putting, this in this sub watershed, and you can reduce the phosphorus by a certain amount. It seems like a more strategic way to do it than the way that the TMDL for Cuba Lake is written.
It was my assumption correct. There did appear to be people who felt there was much more teeth in enforcement for a TMDL than there actually is.
People felt that, yeah. And we, commented many times that the TMDL really only has teeth in the point discharges, which would be the wastewater treatment plants. And I guess the CAFOs are considered, they have a discharge permit as well. But yeah, so it doesn't have much teeth for the non-point pollution. And that's what we have been saying all along.
Okay.
So,
okay, any other questions?
What do you all think about requesting that the comment period be extended to 90 days versus 45? With other groups that are suggesting that if someone can make that motion, we'll do so, and if no one, we won't. So does someone want to make a motion requesting that the comment period be extended to 90?
I move to extend the comment period another 90 days.
Second?
You're
Yes, I don't,
muted, Brian.
Oh, I'm going to second that. Sorry, I had my microphone off there.
okay, great. So we have a motion and a second. Is there any discussion or comment on that, the request that it be extended? Next, all in favor?
Aye.
Aye.
Opposed? So, I don't know how we usually do that. I assume Kathleen, you send a letter, or do you draft a letter for me to sign? However it's usually done. Eileen, I'm sure, has the specifics of who it goes to, so.
We'll draft a letter on your behalf and run it by you before we send it.
Great. Thanks a lot.
Eileen, I have a comment just to add to your thoughts. This is Tim, that I would support the more prescriptive approach to the lake, being as the lake, the size that it is, and if that can be something that comes from the board or the Board of Health or something, you know, I think that would be a wise adjustment and modification to the whole plan.
Hey, Tim, do you want to make?
I'm sorry, Keith, I couldn't hear you.
You want to make that a motion that we
Persist here.
I would make that a motion, yes.
Second for that. No one second that motion?
I would second that, or tack it on with the first motion, kind of do them together. You could do that too.
Well, I agree with we do the letters together, but okay. So is there any discussion on that? The idea of the instructive, prescriptive, specific?
I guess I'd just like to make a comment, and I guess what was the expectation that this TMDL was going to be more prescriptive, and was that, I mean, were people? It almost sounds like we were counting on that.
Well, I can't speak for everyone. I
Yeah,
know.
I think that was a lot of people's understanding. Was going to.
I think the short answer is yes. Any opposition?
All right. Is there anything else on the? Pardon? All right. I don't hear anything, so I'm going to move forward.
Yes.
Okay. All right. All right. Thank you. I have a couple just minor things and then something else. So lead program update. So our lead program has always been reactive. And, you know, once we receive information that a child has an elevated lead level, we then make a home visit to determine if there are lead hazards. And then we issue a notice and demand that the hazards be corrected. However, in an effort to be more proactive, as time allows, upon request, we will now go into a home in which children live or visit, whether they have an elevated lead level or not, to look at potential lead hazards. And we'll do this on a first come, first served basis. Again, only as time allows, because of course, when we get an elevated child, we would make that a priority. But this is a way to hopefully be a little more proactive, get into homes before a child is poisoned. And if there are lead hazards, we can then designate the home as an area of high risk, issue a notice and demand, and work with the landlord on getting the hazards abated. And we will also visit homeowner occupied housing as well. So it's not just tenant housing, but homeowner occupied. So we're taking a small step as we have time to do this, but I just wanted to make the board aware of this change that we're doing. Any questions on that?
How are you getting information out to families who need to know that?
I'm sorry, Elaine, you were breaking up. I didn't hear what you said.
I just was curious, how will families know that that is an option now if they have a concern and you have the time to do it?
Well, we actually have a backlog of people who have just called to request that, just because they were hoping that the health department would provide that service. So we're going to go through that backlog of people who've requested that. And then after that, we will put the word out in some fashion. You know, we don't want to spread it too wide because our resources are limited, and we don't want to get overwhelmed. But once we go through this short list of people that have already requested it, we will get the word out in some fashion, the details.
And those people say, I have paint chipping, I have these conditions that I'm living in, the age of their house. Is that what's prompting them to be concerned?
Yes, and they have little children. But the children aren't poisoned yet. You know, they're not waiting for the child to be poisoned. They're calling us hoping that we can help them. Any other questions? Okay, moving along. So on the watershed rules and regulations, to give an update on that, we sent the draft to the Department of Health at the end of 2020. They received it in early January. And since that time, I've sent 2 inquiries asking about the progress of the review process, and also as received in early April was that DOH, the Department of Health, is coordinating a review among involved state agencies, including DEC and Ag and Markets. And then they said, we are working as quickly as possible during this time of COVID response to get the review underway, and we'll update your office on the time frame as this becomes clearer. So we don't even know like how long this is going to take or anything at this point, but I will keep sending them emails periodically to see if they can give me any more information. Any questions on that? All right, then moving along to my last topic, public notification. So following our report last month at this board meeting about a large manure release, the newspapers carried a story and you know, wrote about it. And after the story came out, which was 3 weeks after the manure release happened, we received quite a few calls from county residents wondering why they didn't hear about it earlier, you know, and they were upset about it. Many people were concerned that the stream that had received that manure was flowing through their property, and therefore they should know about these instances. And they wanted to know why we would be withholding this public information from the public. So after receiving these calls, you know, we discussed at the health department that when we receive a notice of these type of occurrences, that, you know, where a discharge may be a public health concern, you know, right now there is no mechanism to alert the public other than our office issuing a notice. So currently, if, say, a public sewer system overflows, say in the city of Auburn or the town of Owasco, if they have a combined sewer overflow or something that happens during a storm event, they have to make notification through the NY Alert system. The law is intended to give the public information on when untreated or partially treated sewage is discharged into New York State waters. There is no such requirement for, you know, manure overflows or things like that. So we have a good working relationship with DEC, and they notify us when these type of events happen. But as a state agency, they've told us that they're not able to quickly turn around a response to the media. They're not able to put out a quick press release. You know, they're a large state agency, and they're just not as, you know, flexible as we are, I guess, at the health department. We can put one out in just an hour if need be. So we, you know, talked about this, and we prudent from our office to provide accurate, factual information to the public. So that's what we did last week. We issued information about a report that our office received. So basically the report that we received was, I received it from a resident, was that a farm was discharging manure directly into Big Salmon Creek. DEC followed up with me later. You know, they notified us, like I said, we have a good working relationship with us. And they said that that wasn't in fact the correct story. The correct story was that they were discharging the discolored stagnant water that was on top of their cover over their manure lagoon. Kind of like when you open up your pool at the end, you know, in the spring, you've got discolored water on the top. So we felt that, you know, people would be concerned if they saw a discharge of a large quantity of brown discolored water into the stream. The people downstream would be concerned about that. And also, we didn't want the incorrect report, the rumor going around that it was manure when in fact it was not manure. So we wanted to be sure that if that rumor was going around, that we would nip it in the bud, because we didn't want people calling and yelling at us saying, why aren't you telling me that manure was discharged into a stream when in fact in this case it wasn't. And we also worked very closely with DEC to ensure that what we said in our release was factual and as accurate as possible. So we're just kind of wanting to, let the board know that our procedure moving forward will be that when we have a large discharge of material, whether it's manure, fuel oil, or something else, if no other reporting agency is providing information to the media, we will do so. And our intent is to work with our partners, such as DEC, to make sure that we obtain just the factual information. And if information is lacking, we will also report that there is no information on the quantity or what have you. So any questions on that moving forward? No? Kathleen, did you have anything to add?
Not a lot, but I think I appreciate you kind of running down the process, because I think there's been some curiosity within the community why it seems like all of a sudden reports are being made. And it really was a very thoughtful discussion that we had with our state partners. We actually spoke to some of the other partners who may respond when there's other types of situations. So for example, if there were a hazardous material spill somewhere, who typically will take the lead in providing public information. So it's usually the incident commander, the authorizing agency. So as the example of the two most recent articles that Eileen mentioned, DEC would have been the agency of authority attending to these. But as she stated, because it's simply not a timely turnaround time for factual information to be released in the to promote public health in the because we would if it weren't impact the public health, we would not be reporting on anything. The agreement is that we will make sure we have the facts correctly and therefore send out information. So I think it's the right thing to do from a public health standpoint, and to keep it is foilable information anyways. We're not waiting for it to be foiled, and keeping people informed in a timely manner so that they can take appropriate precautions if that's impactful to them, or to stay informed with the correct information, which is important for everyone.
All right, great. So anything else, Eileen? Okay, great. So Kathleen, I think you're next.
Great, thank you. And it was on our agenda. We did take care of our officers last month, so check that off your list. COVID updates. I think I will probably, I won't speak too much about it. I think I shared with you some of the public information that we had received. I was really pleased about, as of April 8th, that it was a chart with some data on it as to social vulnerability and age groups and zip codes that we had received an update of statistics and COVID vaccination rates. We now have the link to that dashboard. We just got that yesterday. We'll be taking a look at that. We don't know how frequently it's updated, and we have a couple questions because of our towns where we have correctional facilities. It's clear in the city of Auburn, there's a separate zip code for the Auburn Correctional Facility. I believe that we need to get some distinction for Moravia, because I think that our numbers don't look quite accurate, potentially that being the reason why. So when we are able to get some clarity on what we are able to identify as areas of concern, we'll certainly share that information. But I will say our area where we shine at the moment, based on what I have seen, is in the area of 65 plus age group. And so much of that credit goes to our towns and village in the city and assisting people to register for clinics, and they were, the initial groups, but who were eligible, but that's the case. I know Nancy's going to speak a little bit to some of the specific outreach that we're doing. We know that vaccination clinics are open to everyone. Johnson & Johnson is now approved. We are making use of that. We had the Johnson & Johnson we had received. The recommendation is to use that for specific populations because of the more challenging nature sometimes of being able to engage the populations we'll outreach to with J&J. Moderna is still available. We're continuing with the second dose clinics, and we're not the only ones, right? We've got other partners. The pharmacies have been getting a steady supply. Some of the pharmacies have, and other agencies. But there's no question that we've really reached a case where people are not registering as quickly as they had been. All our potential clinic slots are not necessarily being filled. So we want to work on that, and that's not unique to us, as all of you, I'm certain, are aware. We want to really find ways to engage people and ways to engage people into getting the vaccine. We have to identify to them why is it important to them to do so. So we'll continue to share information. We're working with local health equity boards. We're part of a regional health equity group where we're really trying to make sure that across the board, everyone eligible is being engaged. So that's all I'll say for COVID vaccination at the moment. The testing, the numbers had diminished significantly with the amount of testing demand at our asymptomatic clinic, that our emergency management office, when I say our, the Cayuga County one, our emergency management office was operating that. They will continue to provide some testing, but they're not doing it this week. They'll engage again next week and limit the hours a little bit more. If the demand increases, that will increase their hour. They will increase their hours. We've had a lot of frustration with WellNow and untimely reporting. And that's something that we are engaged with the New York State Department of Health to follow up with them. It's not unique to Cayuga County. It's happening with other counties as well that have the WellNow urgent care centers. It's a real problem. It's a real problem because people are not getting timely, accurate results. We're not getting notification of that. Isolation quarantine is not happening as it ought to because of that. And we're very frustrated when that happens. So I'm on record saying, if you have an option, don't go to WellNow. Go to a hospital-owned urgent care center, go to your private care provider, go to one of the other sites that will provide you, whether it's in Ithaca, whether it's in Syracuse, with more timely and accurate testing. And other than COVID, we will be talking further with our committees, but we're working with ABC Cayuga to coordinate and appropriate, fine-tune the contracts for relocating our WIC office to the new location on North Street that ABC Cayuga has purchased. And we're really excited. That's going to be a really great early childhood destination. And we'll certainly share more details as we move forward in that capacity. So I'll stop for a moment unless you have particular questions of me.
Not a question, but a congratulations. I think from the board, we'd all like to recognize what a great job Kathleen and everyone at the department has done with the vaccination. It's you hear on the news about how these rollouts aren't going so well, but I think in our county it's been done very, very well. Big kudos for that. Nice job.
Thanks.
We all feel that way. So yeah.
It's a team effort. There's no question, and Nancy's really spearheading the vaccination efforts. So a lot of credit goes to her diligence and persistence and outreach efforts.
Do you have more for us, Kathleen, or are we ready for
I'm all set.
Nancy? You're on.
You're on mute at the moment, Nancy.
I think she's frozen.
Well, Nancy, you could have burst into song, and instead you were on mute.
See. Good afternoon. We continue to be a work in progress, and we have canvassed assisted living facilities from the northern of the county to the southern of the county, looking to see whether we needed to establish some kind of mobile clinic. And we found good results there. They really have just isolated people that haven't been vaccinated, so that's not exactly where we're concentrating our efforts right now. We also have done a hybrid approach, as you're well familiar with our mall clinics. We do where you schedule yourself, etc. We continue to have those. We've also been trialing some walk-in clinic arrangements. And those, again, there's a lot of logistics that have to be considered, especially the management of vaccine. I'm so impressed with what the team has been able to do, because at the current, we have minimal, and they've been for a specific reason why we have had to waste a dose. And I think from all this period of time, there's only been 2 occasions, and it was necessary because of what happened with those particular doses. But overall, we have not wasted drug, and we have fine-tuned our system for accomplishing that. So we will, when we get to, we're exploring right now what we have to do to do those 16 to 18 years old, which is be with the Pfizer vaccine only, and there's some specific management of that Pfizer drug that must be considered. But we do see a need and desire to get those students covered. So again, every week there tends to be something else to look at and conquer. So again, a continued work in progress with the vaccinations. Any questions?
If I could ask a question of Nancy. Nancy, you,
With investigation,
the health department is getting Pfizer vaccine as well as Moderna and J&J, or is Pfizer only available through the hospital?
right, we're exploring that. We do not have Pfizer at this time, but we are looking to certainly explore getting some with the intent of our 16 to 18-year-old, 16, 17-year-olds in school. Because right now our investigation and tracing certainly has highlighted what is occurring in schools, because now they're back in school. They're within 3 feet of one another. There's more socialization, and we're seeing more schools and more cases around school children. So we certainly would like to positively influence that by getting vaccine to the 16 and 17-year-olds. Right now, those persons have to travel to the state fairgrounds, and we know that that's a limiting factor. So we will be.
To add to that, if I could, it is upstate that holds the Pfizer primarily, and then there's some others with the deep freeze. So if we are able to provide things locally with Pfizer, we're going to be working with other counties to just take a very limited allotment, and it has to be, it's so time sensitive, right? Because of the frozen factor. And it's a challenge. And right now, Pfizer is only given an 1,100 dose trace, and we certainly would never accept something like that, even if we had the ability to deep freeze it. So it's a challenge. The one other thing, and then I'll be quiet, Nancy, because I know you're going over some more things. The 7-day turnaround time just got lifted a couple days ago, so that provides a little bit more breathing room for our creative approaches. And if we don't use up all the doses that we've been allocated, we have the ability to continue to use it forward. That's never been an issue for us, but it has been in other counties.
Right.
Nancy, I have a question in regards to the increased incidence that you're seeing in the school-age children. Do you have any sense from the investigations as to whether that is linked to in classroom spread or outside the classroom?
I can't answer that right now. You know, that is a good question. I'm sure we have information on that. I just don't know where that sits today.
Yeah, and I'm sorry to jump in again, Nancy, because that was something that we had. So Deanna Ryan is overseeing our case investigation right now, and she was going to try to prepare some information. There's no question that contacts, they boomed because of school, and that was school contacts, school bus, classroom. But as far as the index case, we'll try to pull together some reports over the last week to see if we can identify where the primary case came from. But there's no question it's circumstances where there was, for example, 3 people on a team who were positive on a school team. Well, and it was at the change of team seasons. So then a few people on another team were potentially impacted. So it's the same thing. If you don't feel good, stay home, right? But not everyone is terribly symptomatic, but and it's allergy season again, as all of you know. So a lot of times the symptoms are downplayed, and kudos to those school personnel and parents who are really staying on top of it and getting their children tested.
So when you say the contacts, you're meaning more people are ending up on quarantine, but it's hard to say as to whether that's being linked with increased cases at this point.
Well, that's what we don't have information on yet, but we'll see if we can get some.
Thank you.
Yes. Mm-hmm. What we have, our focus has always had some bearing on looking at schools and assisting schools with all of this. And now that they're back in school and so forth, they need even more of our timely and responses, and then we've hung on to that. We have just recently engaged with the state. The state's always had for some months now a virtual team somewhere up there that would take and assume some cases and work those cases. And we never found that was going to be what we wanted for our schools, especially. So we have established within the last week a trial with this source, and they have allocated a specific number, people and team to us, and we're going to work with them on a daily basis. So we'll be able to be unified in our approach and also be even more timely with the results, because just this investigation of any school case, as you well can imagine, can be consuming, but very important that it be very timely, 7 days a week. So I'm very happy that they were willing to engage in this trial. And I think it could also be beneficial to the state as well, from what they can learn and practice within a county setting.
Okay, great. Are there any other things, Nancy, or anyone on the board have other questions?
Good.
Well, let's move on to our medical director. Phil, I think you're muted. Do you have any? There you go. Thanks.
Sounds good. Yeah, definitely on the lake business, it's certainly phosphorus control is always a big issue, and a lot of changes going on in certainly in agriculture and management of streams and trails, roads, private properties, excavations, lots of different sources. Seems like we're going to have more loosening in the next month or so with the governor allowing more restaurant occupancy and more contacts. So some studies showed that, again, that outdoor contacts are usually a lot lower risk than indoor contacts, and masks, especially like for athletic events where kids can be distant, you should be okay with less masks, but definitely in things like dugouts or crowded areas, marketplaces, even outdoors, probably masks are always a good idea. But if you get kids separated, outdoors is safer. On the certainly in the Pfizer vaccine, one of my patients that get Pfizer from local Walgreens on Grand Avenue, which was interesting, and I'm not sure how he knew about it or stuff, but it's is available there, and sometimes, anyways. But otherwise, I think the state fair grounds sometimes they'll have Pfizer available there. It's the next closest place I know of.
Actually, we were unaware, Dr. Joya, that Pfizer was available at Walgreens. I think they get their vaccine sometimes from some other sources, so I'm going to follow up with that. That'll be a great resource locally if that's the case.
Yeah, especially for 16-year-olds that are interested, it'd be good.
Okay, great, thank you. Are there any questions for Dr. Joya?
I just wanted to share that I have had some patients who were fully immunized past the 2-week protection time test positive with COVID. They were minimally symptomatic. They did not end up in the hospital, which is of course a significant benefit, but I just would encourage people to be aware that even if they are completely immunized, their symptoms should be evaluated.
Excellent, yeah. Yeah, I know some people as well, just, personally, and it's a vaccine. There are not many vaccines, if any, that are 100% effective, but.
That is entirely correct.
Okay. Are there any other business to come before the board? And if not, I'll take a motion to adjourn.
I'll make that motion, John Kozachev.
A second? Dr. Arnold, second. Okay. I'm assuming there's no objection. So we'll list this as all in favor. See you guys next month, if not before. And thank you very much.
Bye-bye. Take care.
See ya.